Hey everybody, it's Pumill from County Cardiology. Today, we're going to be talking about stress testing. With regards to stressing somebody, I put it in quotations because there's two ways. The first way we stress test somebody is put them on a treadmill. It increases the amount of work for the heart, increases the amount of blood that the heart requires. So if there were to be a blockage in some part of the heart, at rest, you can support that amount of blood flow. But with exercise, that requirement of blood goes up, and a blocked artery could not support that. A lot of people come to see us who can't walk on a treadmill, whether it be due to arthritis, whether it be an underlying condition. I mean, we see a lot of people for preoperative knee surgeries and things like that. They can't walk very fast on a treadmill. So what we do is we can simulate stress. It will actually dilate the blood vessels on your heart. So we give somebody an injection simulating stress. When someone exercises, the blood vessel on top of the heart dilate to give more blood to the heart. So they will do the same thing. A lot of patients will describe that they feel like they're exercising even though they're not. So they'll feel more short of breath. They'll feel that their heart starts to race. It's not causing something harm, but it's stressing the heart. That in itself will give us the result we need. Then you start to talk about what the imaging is. So in addition to this, we start to see what the heart does. So we do that with a nuclear image. We inject some radioactive dye to the body that looks to see if parts of the heart are not getting enough blood flow. In other patients where we don't want to use a radiation test, we can do an echo where we image the heart before they exercise and immediately after they exercise to see differences in how well the heart's squeezing or if certain parts of the heart are not squeezing as well as the others. In certain groups, predominantly younger and lower risk groups, we do just no imaging. We do a regular stress test without any of these images because their baseline risk is lower, so we don't need to go and do these more advanced testing. We could do a baseline stress test on a treadmill that can give us some information. So again, a complex topic, something we often talk about in much more detail in the patient in the patient encounter. Sometimes I think it's helpful just to know what to expect or some of the overviews. So in summary, stress testing will start with both how you stress somebody and if there's any additional imaging to go beyond that. Again, Pumill from County, and it's good to see you another Wednesday.